Whenever it's school time, Divine Atuhurwe rides in a wheelchair. Her sister Martha Ichiriza, who is in her senior 6 vacation, helps push at school daily. Divine loves school, thanks to her friends who make it a safe place for her.
When time for class is not yet, they come to class and play with me and I feel good.
She's in primary 4 at St. Mary Kevin School in Reza along Entebbe Road. Her mom, Peace Ichiriza, is a chaplain at Maize, Uganda. Finding a school for her has been one of her mother's biggest challenges.
But we are lucky at least one accepted. And once one accepts, of course, you have to look for a house nearby to make the journey easy for us.
Sometimes it rains and this place is really muddy. Sometimes we are almost tripping because Divine has a big weight.
This heaviness has affected Martha's chest, and she could be getting heavier, according to Dr. Martin Kasendwa, a medical officer at Mauldmay, Uganda.
Because they don't walk, they don't exercise, so they end up, yet they're eating. So they end up gaining much more weight than they should have.
She's wheelchair-bound, a state she's been in since she was a toddler. The 11-year-old has never walked or run around like the rest of her colleagues.
I want to experience, I want to know how people feel when they are walking. So I would like to walk one day. Yes.
Have they told you?
Sorry.
A wish she might never experience, unfortunately. Divine was born with a defect known as Spina Bifida, which affects the backbone and membranes around the spinal cord. The defect has 3 types, and Divine has the 3rd, which is the most serious.
If you look at the spine, the bone in which the spinal cord runs, it's supposed to be complete. It's like a tube. Now imagine that tube not have missing its roof. You will have an incomplete tube. It's sort of like a U. The spinal cord is running in that incomplete tube, so it's not secure. It can come out. Through that defect in the bone, both the meninges, the coverings of the brain, and the spinal cord can protrude. And when they protrude through the defect, then that's where the issues with the nerves come in. The control of urine and the lower limb movement and the sensation. Now that severe form is a difficult one to deal with.
Her spinal cord failed to close, and by the end of the pregnancy, there was traumatic injury. It occurs within 8 to 12 weeks into a pregnancy.
If they don't take folic acid,
the folic acids can reduce this defect by up to 70% if a mother took them religiously for 3 months during pregnancy and 2 months before getting pregnant. Folic acids help the body build healthy cells. They're easy to come by foods, which include whole grains like brown and wild rice, millet, sorghum, fortified foods like wheat and maize flour, oranges, peas, dried beans, leafy vegetables and fruits. Supplements too containing folic acids can help, and these are what most mothers are given when they go for antenatal care.
Other predisposing factors are diabetes during pregnancy. And then in about 1 to 50,000 cases, we don't know the cause. And there are other medicines, some anti-epileptic drugs, if taken during pregnancy, they can still predispose to spina bifida. The spinal cord, in short, is an extension of the brain, which helps you to get sensation in the rest of the body.
Divine can't control her sphincter muscles when she needs to answer a call of nature.
These are the children who you see getting recurrent urinary tract infections and unable to control their stool and urine. This condition is distressing.
This is a nightmare.
At lunchtime, my sister comes and we go to the library to change. I use Pampers. I change the Pampers when they are wet.
And we have some small corner. She loves privacy. She makes sure all the doors are locked, all the windows.
Some people ask me if I go to Susu. I don't answer them.
I can go without food, but I cannot go without Pampers.
On some days, she changes diapers 6 times.
Recently, when she has been getting infections, sometimes it would be extreme and it would almost pass out in class. Yeah, so she would have to miss school.
Her biggest concern for now is getting help to deal with her incontinence.
If a device is inserted into the child's bladder, it's an electrical device. It will help to control the release of urine periodically. This child has been to all the urologists around Uganda, and We don't have the capacity.
And that's when we kept on applying. Canada, USA, India, lastly USA, Mayo Clinic accepted to take care of the condition.
The operation may cost them about 23,000 US dollars, approximately 70 million shillings. It's money had to come by for this single mother whose husband died when Divine was 2 years old. Many children in Uganda with Divine's condition live miserable lives because of the high costs of treatment. Spina Bifida keeps patients wheelchair-bound for life.
Maybe I think just accept it.
Many of them only hope a scientific breakthrough will one day change their audio. Divine will soon become an adolescent who will have a menstrual flow.
Well, she may not be able to sense that she's in her period, unless if she sees the blood itself.
According to the International Federation for Spina Bifida and Hydrocephalus, people with Spina Bifida are also allergic to latex. The Federation says that about 70 to 90% of babies with a severest form of Spina Bifida also develop hydrocephalus, a condition which enlarges a child's head. Spinal fluid builds up inside the head, increasing pressure and expanding the skull. This damages the brain, can cause mental retardation, and is fatal if there is no treatment. Divine is among the lucky 1 to 3 in 10 who don't get this condition. Florence, NTV.